Hello, my name is Raquel Palazzolo, Community Specialist with LOQW. Welcome to the LOQW podcast series, a space where we talk about who we are, where we've been, and what's happening now. Each episode will share a real conversation about disability services, advocacy, and the issues that impact our community every single day. You can find us on Facebook, Spotify, YouTube, and X. So be sure to follow along and soar with us. Today, we are pleased to have a panel of guests who are here to discuss Missouri's Self-Directed Services Program. We are joined by Ashley Brandis, a support coordinator with SB40, Kendrick, a support broker with LOQW, and Jerry Prough, an employer of Self-Directed Services. Welcome to the podcast. I'd like our listeners to hear a little bit about each of you and your background. Ashley, can you introduce yourself and share a little bit about your experience with Self-Directed Services?
Yes, so I am Ashley Brandis. I'm currently a service coordinator with the Adair SB40. I previously worked for the Department of Mental Health for 9 years with the Self-Directed program, and I was a supervisor for that program for 5 years. And then I was also a support broker briefly before taking my support coordinator position.
Awesome. And Caitlin, can you share a little bit about yourself and your experience with Self-Directed Services?
Yes. So my name is Caitlin Kendrick. I have been with Learning Opportunities for about 4 years now, and I am a support broker. So I basically help individuals with disabilities and their families manage their own service. So basically helping with budgets, documentation, staffing, problem solving, really any issues that they have, I can help them with. But also, what I really do is help people protect their independence. So we want to make sure that everybody has their own right to direct their own service and make sure that they can work on what they really need to, their own self-skills.
Yeah. A core desire behind the program itself.
Oh, yeah, absolutely.
Yeah. And Jerry, can you introduce yourself and share a little bit about your experience with Self-Directed Services?
My name's Jerry Prough. I've got 2 children that are autistic, and both of them receive services. One of them right now is in the Self-Directed Services program, and I live the services every day, with my children, and I see all the benefit that comes out of it, and so I know a pretty good idea about what goes on at home.
Yeah.
So
well, thank you all again for joining us. Now, for our listeners who do not know much about Self-Directed Services, can you explain what Self-Directed Services actually are?
So self-directed services allow individuals or their family members to hire their own staff to come into the home to take care of the individual with disabilities. They train those staff to an extent. They choose the pay rate. They are essentially the employer for their own services rather than having an agency come in whom sometimes doesn't have staff to cover shifts. There may be random people in and out of the home with agency services. So with this program, they're able to hire family members, friends who they know will be consistent with coming into the home, who sometimes already know the individual so that they don't have someone else coming in to the home that they're not familiar with.
So they have more control over who is providing the care.
Right.
Okay. Caitlin, Jerry, do you have anything to add about, what self-directed services are, what they can mean?
Ashley basically encompassed all of that. I mean, like she said, it's about letting the individual choose exactly who they want, because not everybody's comfortable with a stranger coming into their home. And especially with people with an intellectual disability, it's even harder to be comfortable with somebody coming in.
Right.
and being in your home too.
Mm-hmm. Yep, I couldn't agree more. Well, as you are all aware, the governor has released a proposed Missouri Medicaid budget that includes significant changes specifically targeting the self-directed services program. These proposed cuts would affect all 3,527 individuals and families enrolled in self-directed services and are scheduled to take effect July 1st, 2026, if approved. Under HB 10, the proposed self-directed services only changes include a maximum hourly pay rate reduction to $22.88 an hour. Right now, the current maximum hourly rate that personal assistants can take home is $29.04 per hour. So what I want to ask, given that the pay rate is what's being examined and potentially might be changed, what does the pay rate actually include? I invite any of you to comment.
So the actual pay rate that goes, the $29.04 right now and potentially the $22.88 doesn't encompass anything other than just their hourly pay rate. There's employer taxes beyond this that would cover workers' compensation if there were to be an injury at work. But as far as encompassing anything else, any vacation they took, they wouldn't get paid for that. There's no insurance benefits that would have to come out of this $29.04 that they're potentially receiving if they're being paid that maximum rate.
Can they accrue sick time for the time they work, or is there anything else that they would have?
There's no sick time, there's no vacation, and they don't get reimbursed for mileage if they're transporting a client somewhere.
Okay. What about health insurance? Or
no
health insurance. And to add to that, there's no kind of retirement services, there's no kind of retirement plan either with it either. So it's just a flat hourly rate.
Mm-hmm. So this hourly rate, potentially it could have been designed to cover the fact that they're not getting any sick time accrued. They're not getting any health insurance. So basically they'd have to pay it all out of pocket.
Yeah. And that was kind of the premise, from my understanding, behind that higher hourly rate initially, was because there aren't any other benefits involved. It's
okay. Just basically that they're going to have to manage and figure out what amount they're taking home. Mm-hmm. Well, then my next question, based on that, is if the hourly wage were lowered, if a vote passed this idea, what impact do you think it would have on the services individuals with disabilities would receive?
Well, I know one thing. Not everybody, just because the pay rate is $94 or $29.04, doesn't mean that all the employers, the employees would make that wage. I mean, I'm sure that some people out there would start out at a lower hourly rate or whatever, and maybe progress, have some kind of a structure lined out, And the beautiful thing is you're allowed as the employer to do that. So that kind of helps a little bit, with employment and stuff. But for the people that do it, whenever this would be cut, for the, they may have to even lower their amount per hour even lower to compensate for the amount of hours lost in the long run of the hours of services that they're provided, because they're only provided so many hours of service. Mm-hmm. So people might be more opposed to hold back and cut the wages even lower, in order to fill the gap with the hours at the end of the year,
Do you think that if that reduction were to happen, so going down to $22.88, do you think it might impact your ability to hire?
It's gonna impact that a bunch, because, as where I'm at right now, I've got two different PAs that's working for me right now. You know, the population, the town that I live in, Queen City, Missouri, is between 560 and 562 is the population of our town. So I don't have a lot to choose from. They're in town, and I know about 90% of everybody in the town too. So I've had to and you know, I know that these services extend to family members and friends and so on, and that's a wonderful thing. Unfortunately, in my position, all of my families is pretty well gone. All of my immediate family's all gone, and all of my distant family that I'd had that would be able to help have got families and stuff of their own. So, I mean, for me, it kind of narrows it down to, you know, it's hard to find somebody to be able to do this kind of work. So I've had to outsource, you know, and the two PAs that I've got working for me now, they've all got jobs too that they work on the side. So this isn't a full-time employment for them. They're really, honestly, they're just coming up and working 4 or 5 hours here and there just to kind of help me out, and also to help my children or help my daughter. You know, that's kind of the big, that's what it's all about right there. You know, it's all about helping children with special needs, you know, and it's going to make it, you know, I've had to outsource to other local communities around me and stuff, you know, and these employees are having to drive, you know, 45 minutes roughly, you know, to get to where I got to go, get to where they got to go just to get there to do the work. Mm-hmm. So, you know.
And without getting paid mileage, you know, that's a little more difficult. I remember first starting out with you as your support broker. I mean, we were sending out flyers at the local college just to try to get somebody, because you'd already asked around, you know, people that you knew, gone to the church, you know, any local
I believe we even
gatherings.
I put posts on the Facebook swap shop and stuff, and and like you mentioned, we put posts at the college, and I think we had even put some posts up at some of the schools and stuff around and stuff like that. I was eligible for service, I think like 3 years or something like that before I actually found somebody to be a PA for me. And I'd had to, you know, so I mean, and it takes a special kind of person to do this kind of work.
It does.
It's not for everybody, but once you get one found, it's a beautiful thing.
Yeah.
I mean, and it's good for the children and everything. Yeah, you definitely want to be able to keep them, you know. Yeah.
Right. Well, given the fact that the state is trying to save money, obviously, is what we've been hearing from legislators. And so they're considering doing that by cutting the self-directed services. But there's a lot of information out there about the self-directed services actually saving the state money. So, Caitlin, do you think you could share some examples of in what ways do self-directed services actually save the state money?
So, I mean, they really can save the state money. I mean, whenever you have the people directing their own service, you know, they have supports out of their own home. They avoid doing much more expensive things like, you know, doing different placements in a nursing home and a residential facility. But I mean, the hidden savings come from the prevention side of it. So preventing hospitalizations, you know, crisis placements, long-term institutional care. I mean, that is money that the people can use at home, somebody that they trust and work with, rather than having a stranger. You know, maybe in certain situations, when you have a stranger come in to help you, you're not as comfortable. You may be a little apprehensive about letting somebody, you know, touch you, help you up, do really anything and provide personal care for you. That can be hard, you know, for anybody, let alone a person with a disability to come in and, you know, and help out. But with self-direction, I mean, it's a flexible schedule. You're not on somebody else's time. The individual can, if they even have a job, you can work around their job. I mean, there's a lot of different ways that the self-directed service really helps save the state money in the long run.
Right.
And with decreasing that wage, I mean, that is going to definitely have potential issues come up whenever it becomes finding an employee.
Right.
I mean, I know that there's definitely people in self-directed services that are total care that, need 24-hour support, and they get that as much as they can through self-directed services. But if they can't keep their staff because of these wage cuts, they will end up in an ISL or a nursing home. And those are substantially more expensive
those are hundreds of thousands of dollars.
Yes.
And I'm thinking too, as you mentioned, if somebody's managing their own schedule, if there's a week where, maybe they're going on a family vacation, or maybe they're feeling really independent that week, they may not utilize services.
Exactly.
They can say, we're actually not going to need any care this week because they have control over the schedule.
Yeah.
So they're going to be able to just save money and use as needed.
Yeah.
It sounds like
they can use those
right?
hours
Well,
at a different time.
In my opinion, I think they're taking their eye off the ball. And the reason that I say that is because the children, like, for instance, my children are 9 and 10 years old. My children need the services now. Mm-hmm. If the children don't get the services now, then later on in life, they're not looking at the big picture here, because right now is when the children need their services, and we're potentially fixing long-term problems now.
Right.
All we're doing by cutting these budgets and everything is putting a Band-Aid on the problem. Mm-hmm. The problem is not going away. It's right. So, let's say whenever my kids get to be 18 years old, possibly with early intervention and all the good work that we're doing now, whenever my kids get to be 18 years old, they may be dependent. Mm-hmm. They may not require any of these state services or whatnot, and they may be able to be independent for themselves. But as I said earlier, by cutting the wages and losing all the help, I mean, this is going to affect thousands of people. Mm-hmm. These children at this age, they need the help now.
Right. If they take it away, then there's no early intervention. And so the problem's just going to become exacerbated. And over time, they would probably, need more services for a long time. Versus
they're dropping the ball on the long-term outlook on it. What they need to be doing is putting their aces in their places. Yeah.
Now, let me ask you, Jerry, because you're an employer, actually, of self-directed services. So if you had to tell your best caregiver tomorrow their pay is going to be cut pretty drastically, what do you think their next move might be?
Well, they would probably just keep the job that they got, and I'd probably lose an employee, or probably lose a couple employees. I mean, that would be a pretty bad deal, especially for my kids. As we mentioned earlier, how long that it actually took me to find somebody. I mean, the lady that was helping me now with my daughter, she's worth her weight in gold. I mean, her and my daughter's become quite good friends and everything, and she looks forward to seeing her whenever she comes over. Their time together is a really, really good thing. There's lots of learning going on and everything, and I would say that she wouldn't be able to afford to drive up there and work them extra hours after she already had her job. And
now, if you were to lose staff because it just wouldn't be financially feasible for them, is there anybody who could fill in the gap?
I don't have anybody, just me.
Now, in your experience, have you seen other families in similar positions, or do you see these similar types of obstacles on trying to find staff, things like that?
Oh, definitely. And especially in the rural areas when there's no other family to help, and there's some counties where there's no other agencies that cover those counties. So self-directed services is primarily their only option.
Wow.
So then we drop the rates. We're just making it harder and harder for families to get the support that they need. And I do know, just from speaking with some others, that there was an individual receiving medical PA who, or was needing to receive medical PA, I should say, who needed the community specialist, and they couldn't find anyone to cover that RN role. They found an RN because of the rate she is able to receive now through self-directed services. She chose to leave her full-time position to fulfill the community specialist role for this person because they really needed it.
Mm-hmm.
But I mean, if the rates drop this drastically, they'll likely lose her and their medical PA. I don't know what will happen.
Right.
If we lived in a, somebody like me in a small community, I mean, even Kirksville is considered a small community. I mean, if we lived in St. Louis or in a bigger town, there's more people, the population's more dense, all of that kind of stuff. It would be a little easier to find people, and plus you don't have to travel near as far because you're all right in one spot.
Right.
But and there's probably more agencies. There's more workers, service workers, and all of that stuff in a more population dense area. And in these rural areas, the rural areas is where it's really going to affect everybody probably the most. I mean,
because anybody traveling that far, they're going to have to be able to afford a car, all of the car insurance that goes along with it, all along with the wear and tear and the gas. Whereas in the city, somebody could take the job and maybe they wouldn't even need a car because they might be able to use public transport. They wouldn't have as many costs.
Like Ashley just mentioned with the scenario the situation that she just mentioned, if the wages would drop for that would take a special kind of person to to provide the healthcare services and everything along with just, with the regular PA services and everything. And, and thankfully that individual was able to find help. And, the rates was comparable enough that the lady decided to quit doing what she was doing and take this position to be more helpful. And with the rate drop and everything, she would be able to make more money going back to doing what she was doing. How's that going to affect the person that's going to lose services?
Mm-hmm. And it sounds like it took them a while to find someone, even at the current rates. Is that?
Yes.
It did. Okay. Well, let me ask about, this is kind of more of a hidden cost. So right now, the employer or designated representative is currently the recruiter, the trainer, the HR manager, the payroll specialist, all for free. So lots of work being done without any payment given for these services to, be ongoing. So if these cuts go through, and I'll ask you, Jerry, as an employer, if these cuts go through, does the reward of having control over the services still outweigh the massive workload the state is still asking for an unpaid employer?
Absolutely.
Yeah.
Yes, because I get to choose who my service provider is. I know the needs of my children, so I can designate the special services through my PA. It allows me to have control over the situation and be able to reach the goals that my children need at that time and everything. And, I mean, as I said earlier, the children is the main, they're in the spotlight on this. It's not about me. It's not about what I do. It's about what I can do for my children and everything. I don't mind. I mean, and as me and Caitlin had mentioned earlier, about 3 years of hard work, all of us, and you was involved too, several times of us, advertising and looking, and I guess you would say stomping the brush, trying to find something. And I think out of 3 years of looking, we had 3 people that was interested, and it just didn't work out. And I know one person was from the college, and she was looking to take on a little bit more of a workload and everything. But after she kind of, had thought about the situation and everything, I think that she kind of pretty well thought that it was going to be a little too much for her to be able to do that and concentrate on her school and stuff too. So, but there is a lot of work that goes into this that not a lot of people realize. Not only, the advertising part and all that, there was quite a bit to that, but, as you said, handling the situations, the HR part, there's a lot of, every situation is going to be different. There's a lot of different situations that will be different than where I'm at, but, everything kind of requires a soft touch on a lot of this stuff, especially with the kids with autism and stuff like that. You've got to learn special ways, around things to still accomplish your goal of the learning, and having to do all the computer work and everything, and going through and reviewing all of the notes and everything, and going, there's a lot of work that goes into this that's not seen. So, but yes, I believe that the reward of having control is absolutely essential.
Yeah. So if the state is willing to make it possible for you to have a PA, basically allowing enough of a pay rate that's high enough to keep an employee, you're more than willing to keep shouldering all the free labor, that's outside of agency. So as an employer reviewing the records, it sounds like you're more than willing to continue doing that, saving the state that expense.
Yeah.
If you can, hire your own person that you know and that you trust. So it's really kind of on the state to be willing to pay enough to each PA to where you can find someone willing to take the position.
Yeah.
It sounds like.
And since you've started this, it's been a while since I've been your support broker, but how long have you had your PA working for you?
Well, not very long.
Okay.
Maybe, I'd say about a year now, maybe roughly, right around in there.
Okay.
Yeah. And I just got lucky and I got me another PA that's been helping too some. And
what kind of progress have you seen with your child?
Lots of progress. Just it's the little things,
Like I know you mentioned before this with maybe like her structure and routine, like bath time, cleaning her room.
That kind of stuff, yeah, and being able to and being able to overcome obstacles and stuff like that, because the diversity, I believe, helps a lot, especially with children with autism. One person, for instance, me and my kids, you kind of get a little bit of tunnel vision, a little bit, it's just the same old grind, everyday routine, and when you introduce another service worker or care worker, whatever, that really kind of changes things up and creates more of a learning environment and everything, because everything's handled in a different situation. And, like I said, I believe diversity really has a big impact on the autistic, children and everything. Being able to, some kids may have a problem, like I mentioned earlier, with sensitivity problems and stuff like that, and just another person being able to help them through the same process, changing the dynamics of the problem. It helps. It helps a lot,
because you may have a different way of solving a problem than what your PA does,
right?
And maybe it helps your child to have that other viewpoint, to kind of solve it.
And it's just my PA that I have right now, she's created a personal relationship with my daughter, and she's just natural at it. She's just really good at what she does. And it isn't like she studied for it or anything, what I'm saying? It's just,
so she's a real asset for you.
Yeah, it's a real asset for me. And she's changed my daughter's life tremendously. Just in everyday living and helping my daughter to become more independent, and it's been phenomenal to have my PA that I have. Both of my PAs are phenomenal. Both of them are.
So you've definitely seen positive outcomes from the self-directed services.
Difference between night and day.
Yeah.
So we hear from the governor and from legislators in the General Assembly that they're saying self-directed services requires budget cuts. So have these legislators reached out to you about the service? Because there's, to talk about anything related to that, about they're making a decision that's requiring it. Have they talked to you?
Well, I'm not trying to be the first one to speak up on this, but I kind of feel like I've been the last person to find out. And if it wouldn't have been for you telling me about it, I wouldn't even know about this. And I don't know of anybody else that's out here walking the streets around here that has any idea about what's going on right here. I mean, this is kind of an important thing in my opinion.
Right.
They're taking away something that's good for children with special needs. Right. I mean, they're taking away from that. And as I've already mentioned, the long-term effects of that, but that it's they're taking away a good thing.
Caitlin or Ashley, have you been hearing from families? Are legislators reaching out to ask them about the services or anything like that?
Not that I know of. We made families aware. They hadn't heard anything.
It hasn't been on the news. I haven't seen it on Facebook.
No.
Haven't heard anybody talking about it at the coffee shop or somebody read it in the newspaper.
Mm-hmm.
How people should know about this, I mean, when it comes time to vote, if they don't vote correctly, it's kind of like this has kind of been just swept under the rug, kind of, sort of, I mean, it needs to be made more aware to the public.
Mm-hmm. Right.
Well, it can almost be put into perspective. How many companies come in and, say effective July 1st, you're going to get a $7 pay cut and people actually stay.
Yeah.
Yep.
Right. It's a huge difference in pay.
And that can
especially in our economy.
Yeah.
Prices are getting.
What about all the people that's
higher.
already got their life structured out and everything and always looks at the long term of things, and now they're thinking, well, am I going to have to find another job, or am I going to have to do this or that, or because, I mean.
And without staff, the independence of the individuals, it just becomes uncertain. So then families have to step in and provide these, like parents will have to step in, and take care of their individuals, take care of their children.
Yeah.
And they don't have any kind of respite, they don't have anyone coming in to help them out anymore because they just can't afford it.
And as you guys mentioned, with it being so rural, there may not be anyone to step in.
I've already heard, just even with the current rates, like with how rural we are, not being able to find staff, there have been parents in the past that have risked almost losing their jobs because they've had to call in so much because they don't have any backup to help take care of their children.
Yeah.
I, for one, lost my job over,
I remember.
Mm-hmm.
I mean, I lost my.
Stay home with your kids.
Well, I mean, I just, it came to the point to where, my kids is number one, and a good father I am and everything. I didn't have any other option.
Mm-hmm. You had to change your life in order to better theirs.
Yeah, but the one thing that I wanted to mention before we move on, though, the scenario that we played earlier, let's say that, for instance, that my PA decides to do something different because she can't afford to be able to come to me or help me and my daughter or help my daughter primarily. What about all the kids that could possibly cause them to go into remission for that?
Yeah.
Because the services being rendered are all of a sudden gone one day.
Yeah.
So
they're progress.
And that is a big thing with autistic children that I've really noticed and everything, because when things change and change fast for them, they have a hard time dealing with it.
Mm-hmm.
And 99% of the time, they won't move forward.
Mm-hmm.
They'll at least either stop or they'll remission or they'll go into remission.
They'll regress. Yeah.
They'll regress. And I hate to say that I've probably seen more regress than, I mean, it's just kind of the way it goes. And these children are already developmentally behind.
Mm-hmm.
So, I mean, what about all the little kids?
Yeah. Well, let me ask you to the panel. So my last question. If you could sit across from a state legislator or the Department of Mental Health director for even 30 seconds, what would you want to share with them? What is the most important takeaway you would want them to hear about these services?
From their point of view, I feel like they're wanting to hear about how it saves them money. Like they want to hear about the numbers. So with that, I mean, the self-directed service prevents the crisis daily. Like I said earlier, it prevents hospitalizations, caregiver burnout, institutional placements, which is exponentially higher than the cost of what the self-directed services are.
Right.
But beyond the cost, these services provide care and, the ability for a person to remain in their own home, somewhere where they're comfortable. They don't have to go somewhere else just to receive services. They get to make their own choices and live with dignity. I mean, they get to decide what their future looks like and not somebody else.
I couldn't agree more.
Yeah, I mean, there's just one person that keeps coming to mind that is Total Care. And I know that they had a very difficult time finding staff as it is. And this person would, if they can't find care or can't keep their current personal assistants, this person would absolutely end up in a nursing home or some sort of residential facility, and it would just be devastating for him and his family.
Yeah. Mm-hmm. And from what we've seen from self-directed services, not only would that cost a lot more money, but you're not going to see the same, in my opinion, level of positive outcomes.
Right.
Yeah. You're not going to see that one-on-one attention and time given to the individual. So it would cost so much more and be so much less effective.
Mm-hmm. Yeah.
People need the help now, not later.
Mm-hmm.
Well, thank you, Ashley, Caitlin, and Jerry, for your time. It has been a pleasure talking with you today. To our listeners, thank you for tuning in. To share your input, you can contact your local Missouri legislators and senators who are deliberating right now over the self-directed services budget by visiting mo.gov to find out who represents you and their contact information. Reaching out, even briefly, helps make your voice heard. Thank you for listening. Now let's go get started.